Thank you very much, Wolfgang. Dear colleagues, it is an honor and a challenge to be speaking in this venue this evening. You know, Wolfgang alluded to most of my life as a laboratory researcher, but research, no matter what we do, focuses on enduring questions. Sometimes these questions must straddle issues of medicine, history, and our ideas of the world. I'd like to focus on such questions at the International Military Tribunal at Nuremberg in this room. The Nazi hierarchy certainly embodied the essence of malice. What drove them? That is a question that captivates the world today in contemporary events, and it continues to trouble us as we look back and consider the events of World War II. I'd like to discuss this matter this evening in the context of two investigators, colleagues of ours, predecessors, who conducted extensive interviews, 80 hours of interviews with the defendants, psychological tests, and tests, curiously, with the Rorschach, something that, at least in the United States, we don't employ very often anymore. By the end of the war, millions of non-combatants had been murdered, and Europe was in ruin. The world was determined to understand the malice of the Nazi leaders. Peter Townsend and The Who stated the problem lyrically: what is it like to be evil? No one knows what it's like to be the bad man, to be the sad man behind blue eyes. No one knows what it's like to be hated, to be fated, to telling only lies. But my dreams, they aren't as empty as my conscience seems to be. So in fact, what were the Nuremberg war criminals like? This was a question that captivated humanity. How could they do what they did? Were they suffering from a psychiatric disorder? Were they criminally insane? Were they psychopaths, sadists, delusional? What do we as psychiatrists, internists, psychologists, what do we all think about this? This was the challenge faced at Nuremberg. Before describing the research on the perpetrators, it's useful to review their deeds. The mass murderers had a peculiar sense of familiarity. As George Steiner pointed out, the concentration camps are the transference of hell from below the earth to its surface. The camps embody, often down to minutiae, the images and chronicles of hell in European art and thought, the mockery of the damned in a place of whips and hellhounds, of ovens and stinking air. George Steiner made one other observation that will become eerily relevant this evening. He observed that anyone who spends time studying in these dark places must be prepared for an inner resonance of great discomfort. Please recall this comment because it will loom up again. There were many targets for the mass killings. The dots on this map are not towns, but rather locations of some of the camps in Greater Germany alone. This was not an isolated, rare phenomenon, but one that suffused the Third Reich. There were thousands of camps, slave labor camps, ghettos, concentration camps, euthanasia centers. This was part of a vast industry of detainment, slave labor, and murder. contemporary historians grapple with how to convey the enormity of these statistics. I calculated that if one arranged the corpses of the murdered Jews head to toe, the line would stretch from San Diego to Berlin. And that would only be the Jewish bodies. Dutch historians have devised an alternate way of trying to convey the immensity and the complexity of such mass murder. This pixelated image memorializes 100,000 Dutch Jews who were killed in the war. And if you linger your mouse over any one of the pixels, it explodes and provides the details of one individual's fate. There would be retribution for these crimes, and for a time the Allies couldn't agree about the process, as you can imagine, for a long time. But when the war ended, Nuremberg was virtually destroyed, except, paradoxically, for this building and the adjacent prison behind us. This room became ground zero for trying the highest-ranking surviving Nazi members, cabinet members that could be found. There were many subsequent trials, and Professor Levin will be speaking about one of these other trials in the dark times. Many people ask me, Joel, how did you get involved in this? I've spent most of my professional life in that middle part of the triptych conducting laboratory research. But something happened to me 40 years ago. I was in my office in a little garret attic room in a small building on the grounds of Massachusetts General Hospital. No one showed up at that building unless they had a reason to be there. And I had published some work on studies of concentration camp survivors that had a minuscule amount of interest in the media. So someone rapped on my door, and a man came in carrying a gun case and said, "Are you Dimsdale?" I said yes, and he said, "I'm the executioner, and I have come for you." Now, there was no place to call for help. He sat down on my couch, opened his gun case, and I said a little prayer to myself and was also wondering who I had pissed off so remarkably. He opened up the gun case, and it turned out it wasn't a gun case, it was a document case. And out fell all these documents. He was the Nuremberg hangman. And he told me, "Dimsdale, stop studying the survivors. Start studying the perpetrators." I knew them. Well, that was 40 years ago. I was not anxious to carry that study out. It was too emotionally intense. I had other things to do. And I thought, well, how can I study them? It was so long. I didn't interview them. Things were blurry like a Gerhard Richter painting, just kind of blurred by the past. And then I discovered archives. Archives are peculiar things because things are hidden away in there, scattered in unpredictable locations, and frequently uncatalogued. A librarian archivist might simply know there's a box there, but doesn't know what's in the box. So I started working, studying in diverse locations, the obvious locations, the Library of Congress, National Archives, but bizarre, strange little archives that you would know so well about the joys of what a historian does. On one of my first trips at the Library of Congress, this telegram fell out, and it was addressed to Justice Jackson. And it was one of the unusual quirks that emerged. It was from the Harvard criminologist Sheldon Gluck. And you can see the telegram. Gluck suggested that it was vitally important that a thorough pretrial examination be made of the war criminals by psychiatrists, by psychologists, and anthropologists. And he specifically urged the Rorschach. There were many such letters and telegrams, indeed an amazing confederation of professional societies, psychiatry, neurology. It's an astonishing thing how this group of people would agree about anything today other than more money for the NIH. It would be unthinkable. But the letters went back and forth from them to Justice Jackson, to Wild Bill Donovan, to Murray Bernays in the War Department, who incidentally had married Freud's niece. There are these odd connections, and I want to point out that there were specifically interesting linkages with the Psychosomatic Society, and this will crop up again. And basically, all of the letters urged the same thing. Study the war criminals, give them Rorschachs, get their brains so that we can study their brains. And that's what basically everyone said. It's an interesting issue. I mean, the trial hadn't even started yet. People were very concerned about how execution would take place. And well, how did the Rorschachs get here? I mean, Herman Rorschach, he's a Brad Pitt look-alike there. He had a difficult time deciding between medicine and the arts. As a youth, he loved the arts. His father was an art teacher. Like many of us, he struggled as an academic. He couldn't get his work published. His Rorschach test was repeatedly rejected and was only published 1 year before he died as a very young man of peritonitis. The Rorschach test today strikes us as a peculiar choice, but in 1945 it was the best choice there was. And it's both a projective test and a perceptual test. The investigator asks the subject 2 questions. What might this be? And what made you say that? And there are 10 cards. These cards are scored not only on the content, but also on the form, the shading, the color, the interaction with the investigator. Herman Rorschach had no idea that his eponymous test would be so used. He had no idea that World War II was looming. He died, after all, in 1922. He would not know the barbarity that would be emerging in World War II. But there have always been problems with the Rorschach interpretations. And curiously, Shakespeare repeatedly talks about projective tests. If you read Shakespeare closely, and in Hamlet and Polonius are having this dialogue. Hamlet says, "Do you see yonder cloud that's almost in shape of a camel?" Polonius says, "By the mass, and 'tis like a camel indeed." Hamlet, "Methinks it's like a weasel." Polonius, "It is packed like a weasel." Hamlet, "Or like a whale." Polonius, "Very like a whale indeed." The assumption was that the defendants were depraved monsters, psychopaths, but what does that mean? How do you prove it? And in fact, they were a very heterogeneous group of high-ranking defendants. Many of them loathed each other, had little in common other than high office. But present at Nuremberg were two very bright, unusual men, psychiatrist Douglas Kelly and psychologist Gustav Gilbert. They were minor functionaries for the court, but they are our major protagonists in my lecture this evening. They had multiple roles. They had the traditional role of determining fitness for trial and maintaining prisoner morale. They also had a role in advising the prosecution, but they had their own personal agendas as well. They wanted to investigate the psychopathology of the Nazi leaders, and they had their own personal ambitions. Well, the prison authorities were very concerned about suicide, and with reason, as we shall see. Imagine if you were the psychiatrist or psychologist responsible for the defendants. You have to imagine the pressure that our colleagues would have felt in that context. Because suicide was everywhere. These were, after all, very dark times. Cyanide was everywhere. Lest you think I'm exaggerating, these are suicide data for Berlin in 1945. And if you know your history of April, you can understand that suicide enormous increase. The Nuremberg prison was to see multiple suicides in prison during the year of the trial. Today, Robert Ley is not widely known in America. He, partially at least because he killed himself just after being indicted. He never came to trial. But he led the labor front, and he is the only one of the defendants for whom we have a brain. Robert Ley suppressed the labor unions. He had a history of multiple head injuries and episodes of long hours of unconsciousness. He was aphasic for a couple days after a plane crash in World War I, and thereafter he had a persistent stammer. He was also an alcoholic. Douglas Kelly evaluated Ley the day before Ley killed himself. And Douglas Kelly writes, and listen to this because it's the cadence of a mental status exam from 70 years ago or from 7 days ago. It's so familiar. Normal psychomotor reactions and normal attitudes and behavior. Mood is normal, but affect is extremely labile. Rorschach examination reveals emotional instability manifested by color and shading responses and evidence of frontal lobe damage. He had confused form and inadequate construction of responses. He is one of the most suicidal prisoners due to his emotional instability and his old head injury. But Ley is competent. Ley hung himself the next day, and Kelly wrote in his journal, "Since Ley kindly made his brain available for post-mortem examination, we were presented with the rare chance to verify our clinical and Rorschach findings, whereupon Ley's brain was packed on dry ice and shipped to Walter Reed." But that's another chapter. There was a great deal of popular interest in the idea of the lesion in the war criminal's brain. And the race was on to prove that these were evil, brain-damaged, Frankenstein-like monsters. The Sarasota Herald Tribune, Sarasota is in Florida, the Sarasota Herald Tribune quoted the Surgeon General of the Army as saying, "These changes were sufficient to account for the unusual behavior of Ley." Not to be outdone, Life magazine ran a story showing Major Webb Haymaker of Walter Reed, the U.S. Army Institute of Pathology, dissecting Ley's brain. And Haymaker reported long-standing degenerative processes in the frontal lobes consistent with chronic encephalopathy. I'd like to move on to discuss Goering's interactions with Kelly and Gilbert. Goering arrives in prison with 49 suitcases, loads of jewelry, notably large rings, and all of Germany's paracodeine supply. Kelly got very close to Goering, and he spent considerable time with him. One starts to get a glimpse of Kelly as an astute, pragmatic clinician. Goering started complaining of withdrawal symptoms from the paracodeine. Kelly said, Goering was very proud. I suggested to him that while weaker men, like Ribbentrop, whom he loathed, would perhaps require doses of medicine should they ever be withdrawn from a drug habit, he, Goering, being strong and forceful, would require nothing. Goering agreed and cooperated wholeheartedly and went cold turkey. Goering weighed 280 pounds on capture. Kelly was worried about his heart and appealed to Goering's narcissism. When I pointed out that he would make a better appearance in court should he lose some weight, he agreed and lost 60 pounds. Goering was charming, confident, cynical. He was the ultimate Machiavellian. You read these quotes from today and they could leap out from any newspaper in the world. The people can always be brought to the bidding of the leaders. That is easy. All you have to do is tell them they are being attacked and denounce the pacifists for lack of patriotism and exposing the country to danger. It works the same in any country. Goering killed himself with cyanide 1 hour before he was to be executed, and to this day there are discussions about where he got the cyanide. Rudolf Hess complained of amnesia and numerous somatic ailments. He was intermittently suspicious and saved samples of his food to prove he was being poisoned. Seen here is one of his envelopes sealed with sealing wax to prove that it contained brain poison and corrosive acid. I found this, by the way, this very envelope, not the picture, the envelope, in a basement in Silver Springs, Maryland. So, again, it's a peculiar process of trying to find documents. Once Hess asked Gilbert to sample one of his poisoned crackers before agreeing to talk with him. Gilbert said it was fine, and so he munched down the cracker and the two chatted. Kelly and Gilbert both describe him the same way, as preoccupied, withdrawn, and suspicious. Say a brief bit about Douglas Kelly and Gustav Gilbert. Kelly was a genius. He was a Terman genius, the top 0.5% of California youths. He was a Columbia graduate, an expert in forensic psychiatry, personality in the Rorschach, but he didn't speak German. So he needed an interpreter, who I will introduce to you shortly. Kelly's relationship with Goering was intense and close. Kelly writes, Goering was one of the easiest to get along with. Each day when I came to his cell, he would jump up from his chair, greet me with a broad smile, outstretched arm, escort me to his cot, and pat its middle with his great paw. Good morning, doctor. I'm so glad you have come to see me. Please sit down, doctor. Sit here. Then he would ease his own great body down beside me, ready to answer questions. He was charming when he chose to be charming. He had excellent intelligence, keen imagination, great drive, and sense of humor. Kelly spent hours discussing politics, war, and the trial, and Goering regarded Kelly as a well-connected fixer. Kelly agreed to intercede with Wild Bill Donovan, the soon-to-be director of the CIA, on Goering's behalf and to personally deliver letters to Goering's wife. Goering writes his wife, "Today I can send you a letter direct. Major Kelly, the doctor who is treating me and who has my fullest confidence, is bringing it to you. You can talk to him freely." Goering offers Kelly one of his enormous rings in thanks. Kelly refuses, and then Goering responds, "Then I'll give you something even better and more valuable, a signed photograph of me." Gustav Gilbert, on the far right, was an American psychologist from an Austrian Jewish family. He spoke perfect German. He was Kelly's interpreter, colleague, competitor. They became collaborators from hell with each other. Gilbert had a different take on the defendants. One senses he had more personal feeling of hatred for the Nazis. Kelly was intellectually curious about them, regarded them as specimens. However, Gilbert loathed them and urgently wanted to understand their psychology. Both of them overlapped in Columbia, and there's no evidence that they ever knew each other in Columbia. Gustav Gilbert was a social psychologist, wasn't particularly interested in the Rorschach. The following interchange between Gilbert and Stryker gives a sense of his feelings as he was interacting with the war criminals. Gilbert to Stryker, "Why did you have to print all that sexual filth about the Jews?" Stryker, "Why, it's all in the Talmud. The Jews are a circumcised race. Didn't Joseph commit race pollution with Pharaoh's daughter? The judges are crucifying me now. I can tell 3 of the judges are Jews." Gilbert, "How can you tell?" Stryker, "I can recognize blood. 3 of them get uncomfortable when I look at them. I can tell. I've been studying race for 20 years. Gilbert, in his diary, writes about Stryker, "A quarter of an hour with this perverted mind is about all one can stand at one time, and his line never varies. World Jewry and circumcision serve as the channels for projecting his own lascivious thoughts and aggressions into pornographic anti-Semitism." So Kelly summed up his perspective in his book, 22 Cells in Nuremberg. "Nazism is a socio-cultural disease. I had at Nuremberg the purest known Nazi virus cultures, 22 flasks to study." And study he did. He designed the protocol, the Rorschach, the Wechsler-Bellevue IQ test, lots of interviews. This was never introduced in this courtroom in evidence. Actually, the defendants enjoyed the testing. They were like high school kids comparing their SAT scores. And they found the ink blot tests enchanting and interesting. They bragged about their IQ scores, although some of them had nothing to brag about. Kelly, after the war, became a prominent editor and was a professor at Berkeley. I need to move on. So let's look at a card. Let's look at one of the 10 Rorschach cards. Reflect on it for a moment silently. What do you see here? What makes you see that? And I will share the responses that emerged. So, now remember, there were 10 cards, and one scores them. There are a lot of things to keep track of, not just the content at all, but the form, the color, all of that. Hans Frisch of the propaganda ministry says, 2 dancing bears, very clear, or gnomes or dwarves. It makes a revolting impression, not at all friendly. The bloody color makes me feel uncomfortable. Robert Lay says, a butterfly. There are colors here, black and red and white, and he perseverated on that, which is unusual, black and red and white, kept saying this repeatedly. Maybe a stork or a goose would be better. It looks like it was tipped over with its legs pulled in, the jaws of the butterfly. Hermann Goering, he laughs and says, those are two dancing figures, very clear. The shoulder here, the face there. He claps his hands. He cuts off the bottom part of the figure with his hand, and he says, the top red is the head and hat. The face is partly white. Rudolf Hess, very different. Parts of an insect with blood spots. Mask of an island savage. The opening is the mouth. It is devilish. That is why the eyes and beard are red. At first glance, Kelly and Gilbert's conclusions were the same. They both felt that they were sane. Kelly said, strong, dominant, aggressive, egocentric personalities like Goering's, with their lack of conscience, are not rare. They can be found anywhere in the country behind big desks, deciding big affairs. Gilbert said they were ruthlessly aggressive, they had emotional insensitivity, and presented with a font of utter amiability. But the bottom line differed dramatically between Kelly and Gilbert. Kelly said these were basically ordinary people influenced by mendacity and bureaucracy, creatures of their environment, whereas Gilbert said they were narcissistic psychopaths. This gets stranger and stranger. There were peculiar things going on everywhere. As I mentioned, Kelly and Goering were very close. When Kelly left, Goering wept and asked Kelly to adopt his daughter Etta if his wife died. The distrust, meanwhile, between Kelly and Gilbert was exploding. And remember that quote I mentioned earlier about anyone who spends time in these dark places must be prepared for an inner resonance of discomfort. Kelly and Gilbert raced to publish the Rorschachs. But no one would touch it. Everyone was afraid of a lawsuit. And also there was an odd sense of unease amongst the experts. Molly Harrower, who I will mention very briefly, said, in 1946 we espoused a concept of evil which dealt in black and white. Our concept of evil was such that it must be a tangible, scorable element on psychological tests. Kelly came to an unfortunate end. He killed himself on New Year's Day, 1958, in front of his entire family. He was a chef, by the way, a magician, an astronomer. He had very broad interests. He got in a fight with his wife, went to his study, came out and said, I think I've killed myself, and died a minute later in front of his wife, his parents, and his children. None of them know why he did it. His son said recently, cryptically, I think maybe he knew he was on a runaway train. Kelly's study was filled with chemicals, medications, and Nazi memorabilia. Regardless of why he killed himself, everyone noted the method, cyanide, and there were all kinds of speculations about who gave whom the cyanide. Molly Harrower was the world's foremost Rorschach expert. She was on the editorial board of Psychosomatic Medicine, another interesting link with our groups. Imagine she tried to get Kelly and Gilbert together, and She also tried to get experts in the world together in 1947 at a conference in London to review the Rorschachs. She wrote everyone declined. Imagine if the world's most prominent Rorschach expert sent you the files, you looked at them, and you decided in 1947 you weren't going to touch that. That's what Molly encountered. Years later, she got Kelly and Gilbert to tentatively agree to publish a volume together, and that fell apart. Years later, she tried to arrange with Gustav Gilbert. She agreed to publish his work in a journal she was editing. Gilbert got impatient with the editorial process. We all know what this is like. And he committed the cardinal sin of double publishing. That is, while Molly had his paper under review, Gilbert sent it to another journal to be reviewed. And the other journal selects Molly Harrower as the blind independent reviewer. Chance. Finally, Gilbert's Rorschachs emerged in 1975. Kelly's emerged, I think it was 1987. We don't have time to go into that. Miali and Seltzer, in a non-blinded analysis, said of the Rorschachs that they revealed distinctly savage and devilish homogeneous group of warped psychopaths. Well, that's pretty definitive. Molly Harrower said, how could this be? The Nuremberg Nazis were very heterogeneous. And she also wondered, well, you know, if that's where you're going with this, who should you be studying? Should you be studying cabinet officials or the people who were actually doing the killing firsthand? And she said the only way to solve this was to arrange blinded testing. So she, again, decades later, sent the Rorschach deck to 10 Rorschach experts, and she mixed in the war criminals with Unitarian ministers and psychiatric patients. Oops. And the reviews were in, there were no common characteristics of the war criminals. So, how do we understand malice? There really are 5 intellectual traditions for understanding malice. And Gilbert and Kelly represent 2 of these strands. Oddly enough, Gilbert was the social psychologist, but he had a view of categorical diagnoses and psychopathology. He was heavily influenced in the literature of descriptions of psychopathic personality of the times. And I should add that there was always a suspicion, there has always been a suspicion that there's something wrong with the brains of psychopaths. They don't learn well from life's experience, they don't respond to stressors in a typical fashion, and some of them do have brain lesion structures. Remember Robert Lay, for instance. So I just picked out one recent study using MRIs comparing psychopathic prisoners and non-psychopathic prisoners, and the red area shows thinning of the cortex in the psychopaths, as if you could see the reptilian limbic system through the picture. But as I said, there are different traditions. If Gilbert believed in psychopathology, Kelly, the psychiatrist in forensics, was a fervent social psychologist in his views. So, and Kelly's work was enormously influential, and we find echoes of it for the studies that we're probably all familiar with in Hannah Arendt's work. The sad truth is that most evil is done by people who never make up their minds to be either good or evil. In Stanley Milgram's work on obedience to authority, in Darley and Latané's work about bystander apathy, and at the Stanford prison experiment as well. Well, the third tradition is a forensic one, and we all know that law and psychiatry may use similar language, but the resonance and meaning and interpretation of that is vastly different in culture to culture, in state to state. The fourth tradition in examining malice is a religious one. It's embodied in many religious beliefs to the effect that the devil is real. Paul says, "For we wrestle not against flesh and blood, but against principalities, against powers, against the rulers and darkness of this world, against spiritual wickedness in high places." And finally, the last view of malice is the oldest. It comes from the 6th century BC by the Greek philosopher Bias, who said simply, "Most men are bad." So in conclusion, if you were reviewing a manuscript today on the Nuremberg Rorschachs, would you find this persuasive? The sample size was small, it was heterogeneous. Keep in mind that you were testing people in prison facing likely death sentences, and there were some nuances. Sitting on a cot with the patient between you, the psychiatrist and the psychologist interpreting, it's not exactly standard technique for administering a Rorschach. So, despite these limitations, this has never happened historically before. We have never before, not even today, examined our contemporary war criminals from a psychiatric perspective. So our colleagues, our predecessors, deserve some credit for asking the question. I started out by suggesting that there are enduring questions for research. I've tried to summarize how the field struggled to answer these questions with these data. And I'm afraid I've left you with the enduring question as opposed to the answer. These questions pertain not just to Nuremberg, but to contemporary events as well. There is depravity, there is wickedness, there is malice. They are not understood. Dostoevsky says, "Nothing is easier than to denounce the evildoer. Nothing is more difficult than to understand him." In this courtroom, our predecessors made that effort. Thank you.